मैले अपरेसन गरेपछि यस्तो भयो म त तेरा कति नि गरेको
Show me, touch where it hurts. I think there's a lot to unpack with Deepak's story, and it is a tragedy, but it's a tragedy that kind of happens all the time in impoverished nations. And that tragedy is that disability means that you're thrown away from society. Someone that was successfully working as a welder, married, had a great life, gets hit by a bus, and slowly over a period of time, his entire life is lost. His wife left him, not because of anything maybe other than financial need. And it's so critical to be able to work because everyone lives on the edge of severe poverty in a lot of these countries. What you see with him is the product of years of someone just caring for him just enough so that he can be alive, but the type of care that he needs is exhaustive, it's extensive, it's expensive, and it's not something that, quite frankly, even happens all the time in America.
Can you bend your knee?
घुँडा कुम्चाउनु त सक्नुहुन्छ
घुम्चिन्छ
गाह्रो भएको छ कुम्चाउन
गाह्रो हुँदैन
no pain while bending no pain
No pain, yeah. That's I wanted to see if he could shut down the muscle shaking, and he can.
What he just experienced there with Dr. Johnson and myself is what we would call a multidisciplinary musculoskeletal health evaluation in medicalese. In plain English, it's people working together and trying to figure things out.
Okay.
I think the pain itself is coming from several different things. I think he has true arthritis in some of his spinal segments, and arthritic spine pain can hurt just like an arthritic hip or a knee. So we're going to try to pull out some of that fluid, put steroid in all those joints, reduce the pain, and then the other part I'm going to do is what's called trigger point injections using an ultrasound machine to release all the muscles that rotate the hips. His hips are sitting very rotated like this, or externally rotated, and jammed into the socket. So eventually that will wear that joint out as well if we don't do something about it. And it's also one of the key pieces to him walking again, is to get that hip moving normally and get that hip back in the socket where it belongs.
Okay, so you just did your injection. You did L4, 5, 1.
And the SI joints.
Okay.
And then I released with trigger point injections his glute med,
Okay.
his glute mid, and his piriformis on both sides under the ultrasound.
So what we want to really see then is whether or not he has less tone, perhaps maybe even more range of motion, and then we can begin to determine what we want physical therapy here at the hospital to begin to work on over the next year, so that when Operation Walk comes back to Nepal a year from now, he is in a better place for the surgeons to determine if there are surgical considerations that are better approached then because of the work that he's done and some of the changes that they've seen.